Pancreatic cancer. I picked this topic in honor of my grandma, who died after living with pancreatic cancer for 30 months. Overview. The pancreas, an organ in the abdomen, is responsible for the secretion of certain enzymes which aid in digestion and certain hormones which regulate the metabolism of sugars. Pancreatic cancer occurs when cancerous cells, also known as malignant cells, develop in the tissues of the pancreas. Because pancreatic cancer often spreads rapidly, prognosis for patients diagnosed with the disease is usually poor. In addition, it is often very difficult to diagnose pancreatic cancer in its early stages, making it one of the leading causes of cancer-related deaths. Though there are several treatment options, including surgery, which are commonly used to slow the progression of this aggressive cancer, there is no known cure. Causes/risk factors. Though it is not clear the exact cause of pancreatic cancer, the following is an overview discussing the formation of pancreatic cancer. When the cells of the pancreas begin to genetically mutate, they begin to rapidly and uncontrollably multiply. These mutant cells have longer lifespans than their normal counterparts, making them accumulate within the infected tissue. The accumulation of these mutant cells eventually culminates in the formation of a tumor. Because these cells are malignant, the tumor is cancerous and therefore begins to destroy the pancreas. There are two main types of pancreatic cancer: cancers that form in the ducts of the pancreas and cancers which develop in the hormone-producing cells. Depending on the type of pancreatic cancer, the course of treatment may vary. However, although there is no known cause, the following are risk factors associated with the heightened risk for developing pancreatic cancer. Age. Those over 60 are at a greater risk. Race. African Americans are at a slightly elevated risk for developing pancreatic cancer. Pancreatitis. The chronic inflammation of the pancreas. Diabetes. Smoking. A family history of the disease. Signs/symptoms. Pancreatic cancer is difficult to detect early because symptoms don't often show up until the cancer has progressed to an advanced stage. However, when symptoms do occur, they usually include the following: pain in the upper abdomen, which often spreads to the lower back; jaundice of the skin and eyes; rapid weight loss; blood clots; and depression. It is recommended that you go see a doctor immediately if you are experiencing a combination of any of these symptoms, as beginning treatment in a timely manner is necessary for the best possible outcome. Diagnosis. If your doctor suspects you may have pancreatic cancer, the most common tests include ultrasound. An ultrasound creates moving images of the internal organs by using high-frequency sound waves. A transducer, the ultrasound sensor, is placed on the abdomen and images of the internal organs are generated. CT, computerized tomography scan. A CT scan helps the doctor visualize the internal organs by using X-ray images. Sometimes the patient may have dye injected into his or her veins to help highlight the specific areas the doctor is interested in viewing. MRI, magnetic resonance imaging. An MRI uses radio waves and a powerful magnetic field to generate images of the pancreas. Biopsy. A biopsy is the removal of a tissue sample for testing in a laboratory. The biopsy sample can be obtained using a needle, which is inserted through the skin and into the pancreas. Additional tests, if needed. Once a diagnosis of pancreatic cancer has been confirmed, doctors need to do additional tests in order to discern what stage cancer the patient has. The following tests are used to stage the cancer. A blood test. During a blood test, the doctor will draw a sample of blood and test the blood for specific proteins, called tumor markers. These tumor markers are shed by the cancerous cells within the pancreas and can therefore be used as an indicator for the stage. However, this method is sometimes not completely accurate, so it is usually coupled with other diagnostic tests. Laparoscopy. A laparoscopy uses a lighted tube with a video camera at the end to explore the pancreas and the tissue surrounding it. This test allows the doctor to get a visual of the cancer and see if it is spread to other organs. The following is a guide to the stages of pancreatic cancer. Stage 1. The cancer is confined to the pancreas. Stage 2. Cancer is in the pancreas and has spread to some nearby tissues and lymph nodes. Stage 3. Cancer has spread from pancreas to major blood vessels and major lymph nodes surrounding the pancreas. Stage 4. Cancer has spread to distant sites beyond the pancreas, including the liver, the lungs, and the peritoneum. Treatment. The following are several treatment options available to patients with pancreatic cancer. The course of treatment depends on the stage and the exact location of the cancer, as well as the patient's personal preferences. Although there is no known cure, the following may help extend life expectancy, increase quality of life, and help to alleviate symptoms. Surgery. If the cancer is confined strictly to the pancreas, doctors will usually recommend surgery as the best treatment option. Depending on where the cancer is located within the pancreas, surgery options may vary slightly. If the cancer is in the head of the pancreas, the surgeon will perform a Whipple procedure. During this procedure, the head of the pancreas, the duodenum, the gallbladder, and part of the bile duct are removed. The rest of the pancreas, small intestine, and bile duct are then reconnected, allowing the patient to continue digesting food. If the cancer is located in the tail or body of the pancreas, the surgeon will perform a pancreatotomy, removing the infected part of the pancreas and sometimes portions of the spleen. Radiation. Radiation therapy is a procedure which uses high-energy beams to destroy the cancer cells. Usually, if patients receive radiation therapy, they combine it with chemotherapy for the best possible outcome. Chemotherapy. Chemotherapy uses drugs to destroy cancer cells. These drugs can either be inserted into a vein or taken orally. The combination of chemotherapy and radiation, known as chemoradiation, is usually used when the cancer is spread beyond the pancreas and into other organs. Targeted therapy. If a patient has an advanced stage of pancreatic cancer, chemotherapy will usually be combined with targeted therapy. Targeted therapy is a treatment which uses drugs that are designed to attack specific abnormalities found within the cancer cells. The most common of these drugs, Tarceva, helps destroy cancer cells by blocking the signal that tells cancer cells to grow and divide. Clinical trials. Because pancreatic cancer is currently incurable, doctors and researchers are constantly coming up with new treatments which may or may not be effective. Patients with pancreatic cancer can opt to become test subjects for these clinical trials, though most end up not being effective. Prognosis. Because pancreatic cancer is currently incurable, the life expectancy for a patient diagnosed with pancreatic cancer tends to range from about 5 months to 1 year. The percentage of pancreatic cancer patients living over 5 years is only 5%. In addition, pancreatic cancer is often difficult to detect in its early stages, so once a person is diagnosed, it is often too late to stop the cancer from spreading. Because pancreatic cancer is difficult to detect and often spreads rapidly, the prognosis for pancreatic cancer patients is often very